Hi, this is Teresa here. I'm going to do a baby bath demonstration. First of all, I'm going to make sure I have all my supplies close and available to me so I don't have to turn around to get anything. And even if I do, I'm going to make sure I have my hand on the baby like that, and then I'll turn around to get it. You know that for the baby not to fall. Even though the baby hasn't rolled over yet at this age, but it can still fall. So I'm going to make sure that I put my hand on the baby before I turn around. I'm going to make sure the room is at a 75 degrees so the baby it's not cold. I will fill my water, my basin with warm water, and I will check the temp strip to make sure it's the right temperature water. And I'll move the faucet out of way. I'm not gonna put no soap in the water. The baby doesn't need any powder or any um, baking soda because it's dangerous if the baby inhales it. So you don't want to use any powder or baking soda. No baby oil or lotion because that can clog the baby's skin pores too. And the baby bath, you don't want to give your baby bath daily. You can do it twice a week or a couple of times a week. And if the baby is a circumcised boy, you only want to do sponge bath until the circumcision heals. So my water is ready. I'm going to wash my hands and don my gloves. And the reason I'm wearing gloves for the first bath is because the baby just came out of a woman and has blood and fluid. You don't want to contaminate yourself as a nurse, so you always want to wear your gloves to do the first bath. If you don't, it's as if you're going inside a woman's vagina with your bare hands, and you don't want to do that. So I'll have my gloves on. I'm going to put the baby in the water with the receiving blankets on the baby. No clothes on or any diaper. So I have my baby here. I have my washcloths. And I'm going to make sure I have another towel close so I'll put my baby on it to dry. So before I start washing the baby, I'm going to start from clean to dirty. I'm going to start from top, the baby's face to the bottom. And as a grown up or as a baby, you always want to clean from front to back. You always want to clean from clean to dirty. So I'm going to start from the baby's face. And for the purpose of for the purpose of demonstration, I'm going to sit my baby up like that so you can see how I'm cleaning the baby's eye. So with just plain water, warm water, you will clean from the inner counters to outer counters. Then you will change the side of the towel or the washcloth, dip it in water and clean from inner to outer on the other eye too. The reason you want to change the sides of the washcloth is because you don't want to transfer any infection from one eye to the other. So you always have to change the side that you used. Then you clean the rest of the face, the back of the baby's ears, and the inside of the baby's ear to clean the wax. With the baby's ear, you only want to put your finger, one finger in the baby's ear. Nothing smaller than your finger goes to the baby's ear. The reason is the baby's eardrum is close to the surface of the ear and you don't want to damage it. So you only use one finger to clean the baby's ear, both ear. So the baby's face is done. I'm going to do the baby's body, the top. So with soap, I'll wash together. I'll wash the baby's neck, the baby's arms under the arms, in the hand, inside of the hands, and in between the fingers. The babies put their hand in their mouth and they leave saliva in their hand. So you don't want to leave it because if you don't want the baby reintroducing any germs in their mouth when they put their hand in their mouth again. The chest and the abdomen of the baby still has the umbilical cord, and you want to prevent damaging, like pulling it or anything. So you just be gentle with it and wash around it. Also, I want to talk about the umbilical cord. it will fall off between 7 to 10 days. And always when you're doing umbilical cord or watching bathing the baby, you always want to check for sign of bleeding or any sign of infection like odor, swelling, redness. So if there's anything like that, you want to tell your doctor. So you just wash around it, and then you rinse like that. And then you cover the baby's top once you finish because you don't want to leave the baby cold. So you cover the top before you go to the bottom. And with soap again, I'll wash the legs of the baby, squeeze water on it, and then the perineal care, I'm gonna just put water, soap in my hand, and then wash the groin of the baby. And whilst I'm at it, let me just talk about how you do peri care. So with a female, for the first week to 2 weeks, there will be a thick white mucus or a bloody discharge in the baby's vagina. There's no cause of alarm. It's normal because the baby is withdrawing from the mother's hormones. So if you see anything like that, no cause of alarm. And between the labial fold will be this cheesy white thing called vernix. That one with every diaper change and every wiping and baby bath, it will gradually disappear. So you just want to wipe or clean it with every diaper change and every bed bath. And when you're cleaning the female girl, oh, the female baby, you always want to start from front to back. The reason you want to clean from front to back is to prevent any fecal contamination of the urethra. You don't want to introduce any feces from back to front to cause UTI or any infection. So you always want to clean from front to back. So that is done for female. If the baby is a male, circumcised, you wanna the tip of the penis where the circumcision happened will form granulation tissue. It's because the baby is the circumcision is healing when there's granulation tissue. You don't want to wash it off. It's like a white yellowish layer to the area where the circumcision happened. You don't want to clean that off. So you want to be gentle when you are drying it or washing it. Also, with every diaper change or every bath, you want to squeeze warm water on it until the circumcision heals. Also, for the first 24 hours, you want to put an ointment on a 2 by 2 or any petroleum jelly on a 2 by 2 gauze and put it on the tip of the penis so it doesn't stick to the diaper when you put a diaper on. Um, when the baby is uncircumcised, you don't want to forcibly retract the foreskin of the penis because it can swell if you do that and it might not return to its normal position. So you want to be careful when you're washing uncircumcised penis. As the baby grows, the 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 foreskin will loosen up naturally. So you want to be careful when you're washing it. So I think I've covered perineal care. Um, you also want to make sure there's no rashes or any redness in the peri area. If there is anything like that, you want to document it and let the doctor also know. So pericare is done. I'm going to wash the back of the baby. You turn the baby like that, and then you wash the back, and then rinse it. So my baby's bath is done. I'm going to transfer my baby to a towel to dry the baby. And you want to dry the umbilical cord very dry. You don't want to leave it wet. And also when you are cleaning the peri area, be careful with the circumcised baby so you don't peel the granulation tissue. And also with the uncircumcised, you don't want to do it too hard to retract the skin. Female, you wipe from front to back. So I'm finished drying my baby. I'm gonna wash the baby's hair, but I'm gonna first of all change my water. So I will change it, refill my sink, my basin with warm water, check the stem strip again, so I don't burn the baby's scalp. So with a football hold, I'm gonna hold my baby using a football hold, and with soap, I will wash the baby's hair. This will not hurt the baby's soft scalp, soft spots. So don't be afraid to wash it. Get rid of every amniotic fluid and every blood. Rinse it, and then you dry it. And then I'm gonna transfer my baby on the Halo sack. For the purpose of demonstration, I'm gonna move this out of the way and pull it close here. I'm gonna do my baby's diaper. There's a strap to the back. That is where goes to the back of the baby. So where the strap is where I'll put under my baby, like that. And with every diaper change, you want to do peri-care. You want to wipe from front to back for females, check for any redness and any rashes. You want to put warm water, squeeze it on the baby's circumcised penis until it heals. And with uncircumcised penis too, you want to be careful with it in order not to retract the skin. So because the baby still has the umbilical cord, I'm gonna fold the top of the diaper so it's under the umbilical cord. Do it tight enough. Make sure both of them is to meet. The straps meet in the front like that. And the baby should be able to wet at least 6 to 8 diapers a day to show that the baby is eating right. If the baby is not wetting 6 to 8 diapers a day, that means the baby is not eating right. Especially for breastfed babies, you don't know exactly how much they are eating. So if they are not wetting 6 to 8 diapers a day, that means they are not eating right. So they should be able to wet 6 to 8 diapers to show that they are eating right. So I'm gonna use Halo sack, and the importance of the Halo sack is because it's a part of the Back to Sleep campaign to reduce SID. And when we say SID, it's sudden infant death syndrome. So whilst I'm at it, let me talk about how to prevent SID. So the Halo sack prevents you from putting so many beddings in the baby's bed because it keeps the baby warm and snug enough, so you don't put any extra beddings in the baby's bed like pillows, stuffed animals, blankets, and um, bumper pads. You don't want to put none of that in the baby's bed. Nothing in the bed but the baby. No positioners, no wedges, nothing else. And the baby always has to be on the back to sleep, on the baby's back to sleep, on a firm surface. You don't need any monitors, no wedges or no positioners. So your baby always has to be on the back to sleep. The only time you can put only on their belly is when the baby is awake and you, the parent, is awake too. So you can do tummy time for your baby. So you are awake too and you keep your eye on the baby. For the first 6 months to 1 year, you always want to sleep with your baby in the same room on separate beds. So you don't roll over on your baby to cause any SID. Also, another prevention is you don't want to expose your baby to smoke, alcohol, or any illicit drug. Because you, the parent, when you do drugs or you smoke or you do alcohol, you're not going to be in your right frame of mind and alert enough to take care of your baby, and your baby might be in danger. So you don't know alcohol or illicit drug or um, smoke exposure. You also want to do every recommended vaccination for your baby. I think I've talked about um, SID prevention. Oh, and also every time you put your baby down for nap or for bedtime, you can use pacifiers too. That can also prevent um, SID. I think I've covered everything. So yeah, that is how you prevent SID. So I'm going to demonstrate how I would do my halo sac. So you put the baby's arm in the sleeves in the halo sac. You zip up and you bring the Velcro across like that. And the other side of the Velcro to stick to the side here. There's a thing that will stick to it. So now your baby is all snagged and ready for bed. And I'm going to show you some baby hold positions. This is what we call cradle hold. The cradle hold is good for breastfeeding and bottle feeding the baby. Every time you're feeding the baby, this is a good position to hold your baby. It's good for eye-to-eye contact and closeness to your baby or bonding. And it's also very warm. So you can do this for um, cradle hold. And also you one free hand, you get one free hand as a parent to do something else too. Another position is the upright position. This position is used for burping the baby, and it's also secured, and it's very warm too, and it's also good for bonding, and you also get a free hand. Or if not, you just burp your baby and you just hold the baby. You don't get a free hand, I'm sorry. You just hold your baby like that or like this. So that's it for um, upright hold. This is what we called football hold. Like I demonstrated when I was washing the baby's hair. It's very good for shampooing the baby's hair. It's good for just carrying the baby. It's also good for eye-to-eye contact. It keeps the baby warm and also to bond with your baby. And this is good also for if you had a C-section delivery. It's very good to breastfeed your baby. And if you have twins, it's very good to use both hands and feed both of them at the same time. If not, you have a free hand to do something else too. So I think I've covered everything. But if you have any questions, feel free to call me and I'll be more than happy to answer all your concerns. Thank you very much.